The following presentation is a production of Ride the Wave Media.
It's the Best Birth Podcast, where we interview experts that elevate you as you prepare your heart and mind to have the best birth.
Each episode will interview professionals so you are prepared for pregnancy, birth, and postpartum. Our experts will build your confidence and empower you to trust your intuition throughout your pregnancy.
This audio is taken from videos on YouTube. Watch the entire episodes on YouTube at Birth Made Mindful. Welcome to the Best Birth Podcast. On our episode today, we have Dr. Nicole Rankins, our OB-GYN.
Giving birth in a U.S. hospital can be scary, but it doesn't have to be, especially with Dr. Nicole Rankins in your corner. Dr. Nicole is a Duke University-trained, board-certified practicing OB-GYN and mom of two who empowers first-time moms to have the beautiful birth experience they deserve. Over her 20-year career, she's helped more than 1,000 babies into this world and is a proud HBCU grad. Her popular podcast, All About Pregnancy and Birth, is a top 50 parenting podcast with over 2 million downloads. Welcome, Nicole.
Thank you so much for having me.
We are excited to have you on the podcast today, and I am impressed by your commitment to education.
Well, thank you. I appreciate it. I have a heart, soul, and passion for education. So I'm always happy to, education and advocacy are the two big things that I love to do. So I'm grateful to be able to have the opportunity to do both. And can I say, I just love your sign back there. It's perfect.
Thank you so much. Yes, we love it too.
So with your many certifications and years of education, what inspired you to then give the education to the world virtually?
Yeah, that's a great question. So I kind of fell into this work, what I do, just, I don't know, by life circumstances. So I initially started out my career like 1000% convinced that I was going to be a clinical researcher, meaning I was going to do clinical work and do research within OB-GYN. And for a number of reasons that didn't work out. It wasn't actually the right fit for me. It took me like 7 years to figure that out, but it wasn't the right fit for me. And I dropped into a circumstance where I had to leave my job basically because I wasn't happy there. And so I fell into what I do now, which is I'm an OB hospitalist. 99% of what I do is just labor and birth. I only work in the hospital. And as part of that, you don't at all really see the same patients over again. I really only meet patients in labor, which works out great. I can connect with folks, but I kind of wanted more of like continuity and being able to, or maybe different ways to interact with people than just that. So I actually started out, and this is going to be a long story, but I promise I'm going to get to a ending at some point. So I initially started thinking I was going to do health coaching, which is helping people like make changes in their lives. So I became certified as a health coach. So I have that certification as well. But even that still didn't quite feel right. And then I just sort of realized that like so many people were getting information from online sources, and a lot of it just wasn't reliable. And I didn't see a lot of OB-GYNs in this space. And then at the same time, I started listening to podcasts, and I'm like a podcast junkie. Serial was like my introduction to podcasts. See, I don't know if Serial season 1 is like one of the best podcasts that was ever made. So I was like, maybe I can start a podcast. So I started this podcast with education, and that just sort of blossomed into like provide education through the podcast, education through social media. And then here I am today.
Wow. Well, where do you start in helping women educate themselves as they prepare for pregnancy and birth?
Yeah, so the first place I start is helping people understand that they deserve to have a well-supported experience. They deserve to be listened to. They deserve to be respected. So helping people just claim or reclaim that right to have that beautiful birth experience and be centered in their birth experience. And then my education always starts from not telling people to do things one way or another. It's about giving people information to make the best decisions for themselves based on their own unique circumstances, which are going to be different for every person. For some people, they may want a home birth, and that's going to be great. So I want to provide my information as an OB-GYN to support you making the decision of, are you the best candidate for a home birth? Is it appropriate for you? How do you have the right support people? How do you have a backup plan to come to the hospital to see us if need be? Maybe if you want to have an unmedicated birth in the hospital, what are your options? What are ways to manage pain? If you want to go straight to a C-section birth because that's what you feel is best for you, then I want to be able to support that as well. So I'm not about judging or prescription or telling anybody what they should do. It's about giving people information so that they can make the best and most informed decisions for themselves based on evidence-based and factual information.
This type of care is empowering. It really helps us as first-time moms or as individuals who have birthed before to have that beautiful experience in birth. What if we are with a provider and we don't feel as if we are receiving that type of care?
Yeah, the thing I say that is so important is if you can, then change to someone else who is more supportive. And I know that can be challenging depending on where you are and what options you have available to you in your community. But if you can, find someone else who is more supportive of the things that are important to you. You can find recommendations from friends, from family, from Facebook groups. I feel like every city has like we have like a Richmond Moms Facebook group, pop into those online communities or social media, tap into those resources to find someone. So if you can find someone else to do, I've almost never seen anyone regret. I can't actually think of a time I've seen someone regret changing to a different provider if the one that they had did not work for them. So number one, change. The second option, if you can't change, then you really have to be prepared to advocate for yourself. So that means you need to be really educated. You really need to be comfortable with your voice. You should have someone with you who can speak up for you on your behalf if need be, whether that's a partner, whether that's a doula, whether that's a family member. Then you really need to have your own village that you bring with you to support you during your experience.
When it comes to advocacy in birth, what are the steps you're teaching clients so that they can advocate for themselves?
So the first thing I tell people is that I want everyone to understand that I say like birth plans are an important part of that, but birth cannot be planned. Birth is unpredictable. The most predictable thing about birth is that it's unpredictable. So no one can plan birth. I can't plan it. Even doctors who say, oh, you can just come in and we can just have an induction. Even if you have a C-section that's scheduled, you can go into labor before your C-section date. So birth is unpredictable. So go into it with that frame of mind. However, that doesn't mean you shouldn't have wishes or plans or ways to ride that unpredictability. In fact, the way that you're going to feel most satisfied about your birth experience is not necessarily that you have a vaginal birth or that you have a C-section. It's about being empowered with information to ride those waves as best you can and make the most informed choices that you can. So definitely number one, start with understanding that birth is unpredictable. So it's hard to get, you can't plan any specific outcome, but you can still have wishes, still have choices, educate yourself. Education is so important and it doesn't have to be overwhelming. It's not like you have to be reading every single day, and you're not going to obviously have the same level of knowledge and expertise that I have. I've been doing this for 20 years, but you can get a lot of information in a short period of time or with just a little bit of work about what's happening in your body, what's happening with labor, what to expect during birth, what questions to ask. So childbirth education for everyone is really, 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 really important. So I always say that educating yourself, and there are various options these days, right? There's podcasts like this, there's podcasts like mine, there's YouTube videos you can watch, there's books you can read. So there are many options and modalities available to you. So just find something that works for you and definitely educate yourself.
Along with advocacy, what would you give as a piece of advice to someone who finds someone opposing their birth plan or maybe has different views than they do?
So the most important thing I would say is that you should learn that as early in the process as you can. If you are learning that when you get to the hospital, that is too late, okay? Because then you're in birth, you're sort of stuck in the situation that you're in. So ideally, you want to discuss these things you should need to discuss these things during your prenatal visits so that you know well ahead of time what to expect, whether it's going to be your doctor that's there or another doctor for the practice. You want to communicate the things that are important to you in that setting where you could just have more of a conversation and not, under the throes of labor. So you have those discussions ahead of time. So by the time you get to the hospital, you already have an idea, like, this is a hospital that's going to support me being able to move around. This is a hospital that has, I can do intermittent monitoring if I want, or it has tubs or it has showers. So get as much information as you can during your pregnancy. Do not wait until you show up in labor and hand somebody a birth plan. That is entirely too late because it's not helping you understand how your doctor practices, how their practice approaches birth, how the hospital approaches birth. Answer those questions ahead of time. It's going to make you feel so much better when you go into your labor experience, that you understand what you're going into. Stress is terrible for labor. That's like in humans, that's in mammals, period. So if you can reduce that stress, then that is really, really helpful. It's too much stress will really like slow down or stop labor. So you just want to avoid that if you can.
One more comment before we leave this topic. I love just bringing up self-compassion too, because whether we have had one child, 3 children, or wherever we're at in this stage, not shaming ourselves for the knowledge we had at the time. Yes, if we're in a place where we can implement this knowledge, great. We can be empowered. And if we're expecting a baby, we can do more than we did then. But remembering to give ourselves grace for where we were at the time.
Oh, that's so important. We can only do what we did, at that time. We did the best. Most people are doing the best that they can in any given instance. And you may not have known, or it just may not have been knowledgeable. With social media today, you're learning more things, you're being exposed to more things. So absolutely, like, do better when you know better. But at that period in time, you did the best you can. And I will also say that, and this is the frustrating and really hard part for me to say, you can still do all of the advocacy. You can educate yourself. And unfortunately, that still necessarily won't always be enough because you're up against a system that can be challenging. It's sad to say, but a bad doctor can really just derail a birth experience. But you can only control what you can control at any given moment. So just be as prepared as you can. Give yourself compassion, grace throughout the whole process. Making changes in your decision. Maybe you wanted to do unmedicated, then you changed your mind. All of that. It's really important.
The challenges I have found in helping people in the birth space is this system. You've got insurance, you've got hospital policies, and you have some doctors who are practicing with strong preferences. Can we talk a little bit about the C-section rate and how this has been rising and affecting women in their birth plans the last few decades?
Yeah, we have been trying to work on the C-section rate, and it hasn't been that successful. So much of it, well, there are a couple things with it. One is just really trying to prevent that first cesarean, because once you have one, it's going to greatly increase your chances of having another one just because of potentially like lack of availability to try and have a vaginal birth next time. So it really needs to focus on 2 arms. Of course, preventing that first C-section, and then supporting women who want to try for a vaginal birth for the next one. Those are 2 separate things. So the preventing the first one is really about, honestly, it's about time and patience in labor. So many C-sections are done for failure to progress or arrest of labor. And if we just give it more time, then many people will have a successful vaginal birth. The other thing is, which is a little more tricky, is that C-sections may be done because of non-reassuring fetal heart tracing, meaning the heart rate monitor looks concerning. That's a trickier one because honestly, there's a whole gray area of how fetal heart rate tracings look, where the vast majority of the time babies are fine, but it's hard to know for sure. So that's a part of the art part of medicine, of keeping an eye on that. But definitely for the piece of like labor stopping or going too slow, we can definitely decrease that C-section rate. Another one is for breech birth. We should offer more attempts to term breech babies. More and more places are starting to offer options to do vaginal breech birth, which is going to help decrease that C-section rate, because right now most breech babies are born by C-section. So that's important. And then the other one is just supporting folks who want to do it VBAC, having the resources and providers available to do that. It's not complicated. It's just a matter of us having to, the desire and will to implement these things to make changes.
In my own experience, my first son was a C-section.
Mm-hmm.
I was in labor for 40 hours and he ended up being in the OP position. And so that C-section was unplanned, but we did our best. And when I was preparing to have a vaginal birth, I started diving into the research and the education and felt really empowered to then be able to go in and have a VBAC.
Sure.
For a lot of individuals, though, I think that the experience of hoping for a VBAC just comes on relying upon their doctor or their facility. So in what situations would our hospital tell us that they're not able to support a VBAC, but they're able to support that first cesarean? Kind of what are the differences in those two elements?
It's a really great question. So it's like, how can you, like, what is the difference between the two? So for VBAC, the main risk we all worry about is uterine rupture. It's a rare complication that happens less than 1% of the time. But if it happens, it can be catastrophic, and you need to get the baby delivered right away, so fairly quickly. So some hospitals don't necessarily have 24/7 anesthesia available. So they have to call an anesthesiologist in, and they don't want to take that risk that if there's a uterine rupture, that anesthesia is not there. You are absolutely correct in pointing out that, well, can't babies have issues any point in time that it requires an urgent C-section and anesthesia? The answer is absolutely yes. So it doesn't make sense to say that you can't offer VBAC because there's no anesthesia in the house. Because if you can offer a C-section, then, what is the difference? So you make a very important point there. Also, some hospitals require that a physician is in the hospital during the whole labor course while someone is attempting to have a vaginal birth. And the way our system is set up, not all doctors, when they're on call, are going to be in the hospital. Very often they may stay at home and just come in for the birth itself. So that's really a systems kind of issue. Can be overcome, again, if we decide that it's something that we want to do.
In talking about births ending in C-section, is there something wrong with a woman pushing for 3 to 4 hours, or what does it look like from the pushing standpoint?
No, no. I mean, 4 hours with an epidural is a point where we need to reevaluate and kind of see where things are. If there's continued progress being made, then someone can continue to keep pushing and shouldn't be encouraged to keep pushing as long as the baby's heart rate looks good. There can be an increased risk of infection the longer that you push, and it can also make a C-section more difficult the longer someone's pushing if it needs to get to a C-section point. So those are the things that are challenging. But no, there's not like something wrong with somebody pushing 3 or 4 hours. We've certainly had people push longer than that. Most people won't push that long. But some people have we've had lots of folks who push longer than that. As long as progress is being made and baby looks good, then we can keep going.
Yeah, when an individual has an epidural, they may not have those same sensations that tell their body and tell their brain, okay, now's the time to push.
1,000.
And so whenever I talk to friends who have been in long pushing stages, I always wonder, did they need to rest a little bit longer? Was someone coaching them to push even though their body wasn't ready?
Sure.
How can we, avoid that at the last stages of labor so that everything is smooth?
Yeah, sometimes we need to wait. And even though someone could push, we need to maybe turn down the epidural so they feel a little bit more. We kind of start, practice, see how things are going. If nothing's happening because they can't feel anything, we're all wasting our energy having somebody push and nothing's happening. So in that case, it's like, wait for the epidural to wear off a little bit, turn it back a little bit so that people can feel more, try some different position changes and things. So we don't always necessarily have to push just because we can start pushing. There is a study that showed that you can there's a little bit of increased rate of infection if you what's called labor down and wait to start pushing. But everybody is individualized. You really have to take people's own unique circumstances into account. And not all studies apply to every single situation. And you just weigh the risk and benefits and kind of go from there.
Before we leave labor and pushing, are there tools or maneuvers you use patients like as they're going through labor to help it progress?
Yeah, so definitely movement is really important. Tiny, tiny millimeters can make a difference between a baby being able to fit and not being able to fit. So movement is important. So if you don't have an epidural, most people will naturally move on their own. So they will get up, sway or sit on a ball or those kinds of things. If you have an epidural, it's important to know that you can still move. You just need a nurse who is supportive and can help you move and get in different positions. You don't want to just be laying in bed in the same position all the time. We use something called a peanut ball a lot to help with opening up the pelvis. It's literally shaped like a big peanut, and you can put it in between someone's legs and it helps open up the pelvis. We can tilt the bed. We can do things like spinning baby maneuvers where you move the legs and do different things. You can even get in hands and knees with an epidural if you feel like you have enough support. It just requires some will with the nurses and assistants to do it. So a hospital that is comfortable with helping people move with an epidural and not just sit there the whole time.
Okay, and then after birth, can we talk about the fundal massage? Is there any other way to make it a more pleasant experience? I know I always dreaded those.
Yeah. No, that's the that's the short answer. No. I always feel so bad. And let me tell you, I'm so terrible because usually the nurses do the fundal massage. I may do like a little fundal massage and then I'm just tiptoeing out of the room like your nurse is gonna keep doing the fundal massage because it just feels so like, oh, do we have to be. But studies show that it really does help reduce the bleeding. So we're not doing it just because like we want to be mean people. It does help to make sure that bleeding is okay. So I promise that we're not just doing it just to be evil, but yes, it can be uncomfortable.
Sometimes using those hypnotherapy practices, even after birth, can be helpful.
Correct. Yes, absolutely.
And then what is the process with the placenta and delivery after birth?
Oh, yes, that's a great question. So after the baby comes out, then how things should happen is actually for a C-section too, but for vaginal birth, the baby should be brought up onto mom's chest. So we can do like skin to skin right away. Often we may put the baby on a blanket just to dry the baby off. But baby can be put right on mom right away. That initial assessment of baby should be done while the baby is on the mom. There's no reason to take the baby over to the warm or anything like that. We can all just come to the bed and get in there and check the baby out and make sure everything is okay. So that is happening. Then we should be doing delayed cord clamping, which is the process of waiting to clamp and cut the cord for 30 seconds to a minute. Those are the studies that showed the benefit. And all of this is related to the placenta because we have to give it some time. So 30 seconds to a minute to wait to cut the cord. It can be longer. I'll usually wait to clamp and cut it when it's stopped pulsating. So that's going to be anywhere from 3 minutes to 5 minutes. Usually within that period of time, it has stopped pulsating. And during that time, mom is just holding the baby. Then once it looks pale, we clamp and cut the cord, and then the placenta has to come. And that can be up to 30 minutes until we get concerned that, is the placenta not coming the way we want it to? That if it doesn't, then that's called retained placenta, and we have to reach in and get it. That does not happen very often. Most of the time, it's going to come out. Studies have shown that gentle traction on the placenta, not yanking the cord, but just a little bit of gentle just encouragement can help the placenta to come out. And then that usually happens within about 30 minutes. And I always offer people the opportunity to see the placenta. I think it is such an amazing organ. You can ask to see your placenta if you want to, just to see what it looks like, see the sac, see like a whole baby was literally just in that sac, and see what nourishes the baby and the cord. So definitely ask to see your placenta if you want to.
It is quite a remarkable organ, and everything that it provides to the baby is just a miracle.
Yes. Yeah.
You probably have not had a lot of patients that ask for a Lotus birth, but is it a safe practice for the baby to be attached to the placenta long term until it just naturally?
Yes. So we don't have a lot of patients that ask for a Lotus birth. We do have a small number who ask to keep the placenta. The concern about a Lotus birth is the risk of infection. It is an organ, and having an organ out and exposed to elements and the air and bacteria and things, bacteria can develop, and there's still that connection to the baby, so the baby can potentially develop an infection. It's not something that's well studied. So I can't say based on studies that, there's a demonstrated higher risk of infection, but that's the theoretical risk that you're going to get a risk of an infection after that. And I will say that like in that Lotus birth is not something that in the past or historically that humans have done with birth. Like we've always separated the placenta shortly after birth. So it's not something that has like a historical basis. So there's no demonstrated benefit that I am aware of keeping the baby connected to the placenta, because once it is pale and there's no blood flow going through it anymore, there's no like transition of anything between the placenta and the baby. So I'm not even aware of what theoretical benefits people are looking for. Like I know theoretical benefits of people consuming the placenta afterwards, like placenta encapsulation, and we could talk about that if you want to, but I'm not aware of any like theoretical benefits of keeping the placenta attached.
When it comes to placenta encapsulation, there hasn't been many studies or research done. Can you share some of the pros or cons of placenta encapsulation?
Yeah, again, you're right. Not a lot of research done. There is some small data that maybe it may help with bleeding afterwards to consume the placenta. It can also help with mood and reduce the risk of postpartum depression with consuming the placenta. People just have thought that it may help with healing in general. So those are the main benefits, mood and bleeding afterwards. Now, if you do decide that you want to do placenta encapsulation, then you definitely need to do it in a way that's safe. So the placenta needs to go on ice afterwards. So that helps, prevent any bacteria. If you have an infection diagnosed during your labor, then you don't want to consume your placenta because you're going to be eating an infection, and that's not, healthy. If you have group B strep during your pregnancy, it's probably going to be in your placenta, so you don't want to do placenta encapsulation then. There is one small study of someone who consumed their placenta afterwards, and the baby got group B strep infection, and they thought it was from the mom consuming the placenta, and then somehow the group B strep getting into breast milk. Now, the dots connected between that are not very clear, but it was the same strain of GBS that was in the placenta, apparently. Like they tested the pills afterwards that the baby got. So that was like one case report. So that is theoretically possible. The other thing you want to do is if you have someone who does it, this isn't something that's regulated. So you need to make sure they're doing it in a clean space. You need to make sure they're not mixing your placenta with anybody else's placenta. And that there are some certifications, I believe, that are out there to do it, but that they're doing it in a way that is hygienic and keeps it as safe as possible.
Do you have any other recommendations for improving mood or helping during the postpartum period?
Yes, I would say get some help if you can, so that you have the opportunity to just rest, both physically and mentally. Don't feel like you have to especially in the US, there's this snapback nonsense of getting right back into things, and you got to get back into working out, and you got to get back your pre-pregnancy body. Just stop all that. Take some time and just kind of be in the moment of having your baby and just connecting with your baby. Both of you all are getting to know each other during this period. So if you can get help with things so that you can just focus on that, that's great. We definitely underutilize postpartum doulas. So if you don't want to do a birth doula, maybe you want to do a postpartum doula. And you don't have to do a postpartum doula every day. You can have somebody come in once a week. Even once a week for a few weeks is going to be helpful to give you some tips on how to do things with the baby, give you a little bit of a break, help clean up. And if people ask for help, then don't be afraid to tell them, yeah, I need 3 freezer meals, please. So be okay with accepting help and not feeling like you have to do all of the things on your own. I think that support can definitely help with your mood. And if you're finding that you're depressed, beyond the blues, then definitely seek out help also in the form of professional help if need be. Maybe you need a therapist. Maybe you even need to start medication. But don't be afraid to get help in that postpartum period to help with your mood.
I love your advocacy work as part of your life mission. Could you speak to racism for a moment and why racism is still prevalent in the birth space?
Yeah, I mean, if somebody could figure out why racism is prevalent in the world, we could like just have so many because it's like completely made up construct that has no biological basis whatsoever. So it's just, I think historically, we're just still dealing with centuries of racism in the United States and stereotypes that are ingrained in our culture, often on a subconscious level. Because you have so many people who say, I'm not racist, and they're not willing to see that maybe they are making decisions or choices based on that person's appearance without knowing it necessarily. We all have instances where we judge folks, right? Where it's just a human tendency, it's a human nature, or where we make assumptions based on people, based on the way they speak or the way they look or things like that. That's kind of a natural thing. Where we have to stop that and use our higher thinking human brains is deciding like, I did this thing. This doesn't make sense. Now I'm going to make a different choice. So it's okay. I think we need to open up the space to acknowledge that, yes, sometimes we do make decisions based on the way people look. It's how you act on those decisions. And are you willing to change course and realize, you know what, that wasn't based on anything that is real. I need to do something different.
Yeah, when you look at some of the numbers and the statistics, it's devastating that it is still showing up in very real ways.
Mm-hmm. Mm-hmm. Yeah, like my risk of having issues with pregnancy as a highly educated, college educated Black woman is about the same as a white woman who completed high school. Like something is wrong there.
What do you recommend that can be done from just an individual basis? Obviously, we're not able to affect the system or completely abolish racism, but how can we as individuals make a difference in this movement?
Thank you. Really good and important question. It's about starting conversations in your own world or sphere and opening people and your children to the fact that people look different and they shouldn't be treated differently based on that. So if you have children, then expose them to dolls, expose them to books that show lots of different types of people so that they're comfortable and understand that there are different types of people in the world and there's space for us. And we don't treat people different based on the way that they look. So definitely start in your own environment. And also, if you see people saying or doing things that are racist, then call them out on it. Have a conversation. It can be tough. And Lord knows that with some of the things going on, some families have been fractured because of it. But you can have conversations and not do so in a mean or threatening way. You want to do it in a way where you're not like judging people, where, that kind of thing, or telling them that they're horrible beings, but you just want to open the conversation and the discussion in your own community so that we all do better.
We have a Mom Squad secret for the week, and this is from Christina. She says, every time a baby is born, a new mother is created. A mother's health is crucial to the success of the family and the baby's growth and development. Don't brush aside your needs for the needs of the family.
That is so important. I always say, and this is even during pregnancy, the most important piece of having a healthy baby is a healthy mother. So if you need to, during your pregnancy, to say, take medication for depression because you're struggling with depression, then please take the medication. Because some people are like, oh, I want to avoid medication. I don't want to expose my baby. Your baby is going to be affected by your depression, for instance. So you have to be well and healthy in order to take the best care of your baby and to be the best mother for your baby. And the what you said about mothers being the backbones of families really is just so important. So yes, you gotta have a healthy mom in order to have a healthy baby.
If there's one thing that we have learned throughout this podcast, it is the love, the care that is needed for ourselves so that we have thriving mothers and thriving babies in the end.
Yeah, absolutely. And the US is just so behind in terms of recognizing that and supporting that through policy. Other wealth resourced nations that are similar to the US on resources do so much better with things like paid parental leave. Like in Canada, we'll get a year of paid parental. Like this is crazy. In other countries, people get like a pelvic floor physical therapist immediately as a referral after birth. People get a nurse who comes out to their house after birth. So we just definitely need to realize that we're investing not just in ourselves, but in families and in society when we take care of moms.
Well, you have provided so many great resources for us. Are there any other resources that you'd like to share today? You mentioned books and podcasts. Do you have any favorites?
Well, I mean, I'll have to mention my own podcast. It's called All About Pregnancy and Birth, and that is my baby. I love it. I do birth stories on the podcast, primarily hospital birth stories. I interview experts and I talk about topics. So you can find that wherever you get podcasts. Also, I'm on social media at Dr. Nicole Rankins as well. But again, there are other resources, the things that you all are doing. You just have to find what resonates with you when you hear people and the information that's provided, and stick to it. Educate yourself. It's easily doable and possible.
Thank you so much for sharing your wisdom, your insights, your personality. I've loved this conversation, and I know our listeners will too.
Oh, thank you so much for having me. As my children are teenagers, and as they say, like I can yap a lot. So hopefully I wasn't yapping too much during the conversation because I could talk about this forever.
Definitely not. We loved it and it flowed very well.
Thank you.
That's a wrap. Thanks for joining us on today's episode. We hope you've been elevated and inspired by this week's expert.
Subscribe today so you never miss an episode. And please share our podcast or post on your social media so that other moms and dads-to-be can also have the best birth.
Please note that the information provided is based on the expert's insights and personal experience. It is not intended as medical guidance. Please seek the advice of your medical provider as it applies to your specific condition.